IRG Physical and Hand Therapy's Health Talk continues. I'm Ron Schakal. He's Shannon O'Kelly. And our next guest is Dr. Cuevas, Doctor of Chiropractic at Divine Spine Chiropractic and Wellness Studio. And what's he going to share with us today, Shannon?
Well, he's going to talk about the importance of mobility. And I love this topic. As a physical therapist, our root training, our foundation is movement, mobility. And what we know with wellness and health, the human body is designed to move. And when we quit moving or lack of movement, that's where we start seeing some of these diseases creeping in. So mobility is really important.
Here's Shannon and Dr. Cuevas.
Dr. Connor Cuevas, thank you for joining us on Health Talk. How are you today?
I'm wonderful. Thanks for having me this morning. Or this afternoon.
Yeah, you bet. I'm glad we're getting some time to talk. We're talking about kind of my favorite subject, and I'm sure you enjoy it, but we're going to be talking about mobility, movement, mobility. But before we get into that topic, tell our listeners about your practice, kind of your area of interest in your practice, maybe your background, how you got interested in doing what you do, kind of the day in the life of Dr. Connor Cuevas, okay?
Absolutely. Well, first of all, thank you for having me. It's always such a pleasure speaking with the like-minded individuals and listeners about health. Like you already said, my name's Connor Cuevas. I'm a chiropractor. I'm the clinic director of Divine Spine Chiropractic Studio here in Ballard, North Seattle. We are an entity of the Health Connection, which is a larger office we have down in the Tacoma area. But basically what we offer is a range of different health assets and resources, from chiropractic care, acupuncture, massage therapy, nutritional counseling, movement training. We're kind of your one-stop shop for all your natural healing methods. And we also work with other health practitioners in the area to offer our clients the best fit. So as a chiropractor, in short, I just help people heal. For some people, that means moving or feeling better. For some people, that means breathing or sleeping better, processing thoughts, emotions better. But, a lot of people come to me for aches and pains and weaknesses and things that are getting in the way of their, daily activities. But essentially, these things are presenting a problem. So I help people solve problems. So for every person I work with, my approach is a little different, depending on the person, their life's experiences, and what goals we want to accomplish. For some people, that might be regulating their nervous system, regaining movement, or nourishing their diet. And I really became interested in, I guess, a student of health at a young age, learning from my grandfather, who was a psychotherapist. Growing up with this foundation of health in my life, I knew from a young age I wanted to help other people understand health and what it means to be healthy and the lifelong pursuit of that. So today we're talking about movement, why movement is important to our health, and how our relationship with movement, I think, is changing.
I love it. Let's keep going. First of all, I love what you're talking about. I think we're moving towards this, what I call the soft skills, which we probably did a long time ago and maybe got lost in some objectivity. You have to have functional goals, you have to have numbers and stuff like that. But reality is those goals are important. But what really is important, what we call here at IRG, what I like to call the soft skills. I like the fact that you're talking about lifestyle medicine, you're talking about health, you're talking about mindfulness, gratitude, some of those simple skills that we kind of got lost, I think. And that's cool, isn't it? That you're starting to use that in your practice?
Yeah, very, very simple tools that everybody has access to.
Oh, absolutely. Go ahead real quick. One of the things that I think you and I both as clinicians probably know sometimes you can have all the skill in the world, all the procedural skills, all the manual skills. Sometimes what the patient needs is just to sit down and have a conversation, right? Sometimes the power is in listening, intent listening, and then building relationships and building engagement. And then, like you said, that lifestyle movement, mobility. So let's talk about mobility here.
Yeah, that's where the magic really happens is developing a relationship with somebody and somebody you can, feel heard, and somebody that can, speak to you. So mobility, that word's tossed around a lot, but movement, our body is really designed to move, and it functions best when we're actively pursuing that. And so, every cell, every tissue, joint, every thought and emotion, all of those things in our body, they're really dependent on movement for optimal function and longevity.
More with Dr. John Connor Cuevas and Shannon O'Kelly right after this timeout on Como News 1000, FM 97.7.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Welcome back to the show. I'm Ron Schakal, filling in for Tom Hutler. You know, it's something that's important to all of us, how mobility affects our health. Let's learn more with Dr. John Connor Cuevas and Shannon O'Kelly.
Okay, Dr. Cuevas, chiropractor, we're talking about movement, we're talking about lifestyle medicine, and mobility is so important. And I think our listeners need to understand when you stop moving and you quit moving or you get put in a position over a period of time, your tissue, tell our listeners about just adaptive shortening, your the restrictions and the tightness. If you're not using it, you lose it, so to speak.
Yeah, absolutely. So, I mean, every muscle, every ligament, every soft tissue in our body is designed to expand and contract, to lengthen and shorten. And it's when we're not moving that these processes start to break down and suffer. So it's just another reason why we got to keep our body moving, not just for these like very interdependent or intersegmental, if you will, processes, but also like global movement and what that generates for us as well.
Yeah, it's so mechanical. I mean, we like to talk in movement and mobility of the kinetic chain, right? And you do that a lot, it sounds like, in your practice, kind of looking from the floor to ceiling type situation.
Yeah, well, obviously we want to hear about people's complaints and we want to help people with those, but we don't really focus on those because there are a lot of really important things that you can miss if you're only focused on where the pain or the symptom or the problem resides. So rather than, treating people for their symptoms, we just treat the person. And we find that when we do that, our results are just so much more effective.
And a lot of people, I notice that here we are kind of ending the year and kind of starting a new year out. Sometimes people get so excited they go out of the chute, so to speak, really fast, and they kind of hurt themselves, or they have an overuse or maybe an inflammation, and they get discouraged and they stop, right? And you have to take your time. What you tell your patients.
For the past 22 months, I don't know who's counting, but our world has just kind of flipped upside down in our daily routine of just leaving the house for work or school or attending our favorite yoga class or exercise class, traveling to different countries, gathering with friends. All those things have come to a stop. And for a lot of folks, they're working remotely or working from home, or what I like to say, they're living from work. And so people are no longer are moving. And so we need, in order to feel good and perform well and maintain this healthy quality of life that we're all pursuing, we got to start to make some changes in our everyday environment. So a few things that people can do just to kind of like take some small, simple steps back into getting some more movement is just setting aside a little bit of time each day, once in the morning before you start your day and once in the evening before you get, start to wind down. Move your body a little bit. It doesn't have to be complex or difficult. It doesn't have to involve equipment or even the company of others, but maybe taking a walk around the neighborhood or sprawling out on the living room floor and just getting some stretching in or just like simple movement. However it looks for you, developing a daily routine is just going to help you generate more energy and more comfort and more focus to get through the week.
Yeah, just get out, just so to speak, the Nike thing, just do it. Don't stop moving. You make some great points. We are out of time. Dr. Connor Cuevas, thank you so much for information. Mobility, do it. Just move. Thank you again.
Yes, thank you.
Thanks to Dr. Cuevas and great information. And Shannon, I feel like I better get moving if I'm going to have a good long life based on what Dr. Cuevas is sharing with us today.
Yeah, Ron, there's so much research. A little bit of movement is a pound of cure, so to speak. You know what I'm saying? An ounce of movement is a pound of cure.
Absolutely. And if you have questions about any of these topics, feel free to go to irgpt.com.